We're just getting a couple technical things set up and we'll get started here shortly.
All right, well, hello and welcome to our news conference today. This is a virtual event being hosted by Beaumont Health and Spectrum Health. My name is Mark Geary. I'm head of communications for Beaumont Health, and we're thrilled to be joining you today here from Southfield at Beaumont Health.
And I'm Carrie Manders from Spectrum Health Marketing and Communications, and I'm thrilled to be joining you from Grand Rapids. And thank you all for joining us this morning. Our objective is to provide you with more information about the coming together of our organizations as announced earlier today. Keep in mind, we have just signed the letter of intent, so there may be questions that we will not have answers for yet, but we are committed to sharing updates on a regular basis throughout the due diligence process.
So we're going to start this briefing with some opening remarks from Tina Fries-Decker, who is Spectrum Health's president and CEO. We'll also hear from Julie Freem, who is Beaumont Health's board chair, Bob Roth, who is Spectrum Health's board chair, and John Fox, the president and CEO of Beaumont Health. In addition, here today we have Dr. Mansour from Spectrum Health, as well as Dr. Welsh from Beaumont Health, and they'll all be here to answer questions at the end.
And once the opening remarks are complete, we will open it up to questions from the media. You are welcome to record this briefing for use in your stories. Closed captioning for today's media briefing is available through the Zoom platform. You can simply go to the settings tab, tap meeting, and toggle closed captioning to on. A recording of this media briefing will be made available with American Sign Language interpretation for our deaf, deafblind, and hearing impaired community members. We will call on you, outlets, to ask your questions live. We will take as many questions as time allows, and feel free to place your questions in the chat. We ask that you keep your cameras off and your microphones muted until that time. I'll now turn it over to Tina Fries-Decker, who will be the president and CEO of the new health system. Tina will be followed by Julie Freem, who will be the board chair of the new health system. Tina.
Thank you. Good morning. I am thrilled to be with you today and excited to announce that Spectrum Health and Beaumont Health are taking the next step in our shared, bold vision to transform health in Michigan. This week, we signed a letter of intent to explore coming together to create a new health system. Our purpose has never been more critical and more important than it is today. What we've been through collectively in our state and our country over the past year has crystallized why we exist and what we do on so many dimensions. But it also tells us what we can do even better. And it is through this lens that we are excited about the opportunity to bring together Spectrum Health and Beaumont Health. We have similar missions and visions, as well as future aspirations. We have long track records of providing exceptional clinical care for our communities, as well as a strong focus on academics and research. Our physicians and teams know and respect each other, whether it's collaborating on statewide issues or sharing insights on quality research and clinical care. Together, we are uniquely positioned to deliver value in exceptional care and coverage that is accessible, equitable, and affordable, while maintaining our unwavering commitment to our local communities in Michigan. And this allows us to build upon our complementary clinical strengths, expand access to more Michiganders, and make important investments to improve the health and well-being of people across our state. We will invest in our people through training, development, and career opportunities. Since our markets do not overlap and are distinct, I do not anticipate any closures or loss of jobs at this time. We will also invest in technologies, facilities, research, education, and a culture based on values, inclusion, and innovation. But this isn't about Spectrum Health and Beaumont Health. This is about the people we serve and about transforming health in Michigan. We are coming together for Michigan by Michigan to improve the health of all of our communities, and I am so energized about this. Now I will turn it over to Julie Freem, our proposed Health Systems Board Chair, to share a few comments. And I'm really looking forward to working with Julie.
Thank you, Tina, and good morning to all of you. This is just a super great day for Beaumont Health. The board of directors of Beaumont Health, the management team, and I am confident that the future is bright. Beaumont has explored other partnership opportunities in the past, but this one is truly different because it's for Michigan, by Michigan. Beaumont Health is the leading health system in Michigan, and to continue to lead, we must make bold decisions like this one. From a governance perspective, one key point I'd like to emphasize is that our new board will have equal representation from both organizations. As Tina mentioned, there are many benefits associated with creating a new organization together. We have complementary strengths. Our markets do not overlap. And from Beaumont's perspective, we recognize the value of having a health plan. The opportunity to partner with Priority Health is appealing. As one new organization, we will have greater ability to invest in Michigan's healthcare future. Some specific investments include our people, their training and development on medical technology and best practices, our facilities, more private rooms and expansion of outpatient services to make care more convenient for Michiganders, our technology, new investments in telehealth and telemedicine to meet changing patient needs, and finally, quality care, more significant investments in new services, procedures, and technology to bring best-in-class care to all Michiganders. Beaumont Health and Spectrum Health are also both committed to the highest quality care. I'm confident that together we will raise the bar for health care across our state. Our new system will be about the people we care for throughout the state. We value our communities and our team members' perspectives about how we can improve healthcare and provide even greater value for the people we serve. Mark, I'll turn it back to you.
All right, thank you so much, Julie. I'm going to turn it over now to Bob Roth, who is the Spectrum Health Board Chair.
Thank you so much, Mark. The prospect of creating a new health system and the difference it can make for the citizens of Michigan is just truly exciting. The idea of coming together to be stronger is in our DNA. When some 24 years ago, Blodgett and Butterworth hospitals in Grand Rapids, Michigan came together to create Spectrum Health. Since that time, we've a proven track record of successful integrations and partnerships that improve quality, the access to care, as well as the coverage of care, while maintaining that really important local relationship with physicians, donors, and community members. Our ultimate focus is ensuring high quality care for patients and members that's sustainable both today and for tomorrow. And we're confident that creating a new system with Beaumont Health will achieve that goal. Physicians, nurses, and other team members who are closest to the patients and people we serve have built cultures of excellence, innovation, and inclusion. They are the heart of both of our organizations and drive care and compassion that is central to who we are as Beaumont Health and Spectrum Health. Their input and experience will help to realize the mission and vision for this new organization. We believe this will truly be transformational. Carrie?
Thank you, Bob. I'll now turn it over to John Fox, Beaumont CEO, for your comments. Oh, John, I think.
Hang on one moment, John. You need to unmute yourself.
My apologies. I thought I was muted by you. Thank you, Carrie, and good morning, everyone. Thank you for joining us. I think we all know that healthcare has really got a lot of room for improvement. And we believe our coming together as one health system will enable us to take the significant steps necessary to drive needed change. To improve the health and well-being of the people in the communities we serve, we need to make healthcare easier to access and, very importantly, more affordable. In bringing together Beaumont Health and Spectrum Health, we truly have an incredible and unique opportunity to create a new healthcare system through the strengths of the state's two most respected healthcare systems today. Coming together represents the best of both worlds, keeping care close to home and focused on the needs of our local communities, while building a strong infrastructure to make investments where needed for the future. This opportunity is very good for Michigan, our patients, our communities, our physicians, and our employees. Thank you, and Mark, I'll turn it back to you.
Thank you, John. And now the last two people that we'd like to hear from are the two physicians who are here with us today. As we've said, there's been quite a lot of physician involvement throughout this process. We're going to start first with Dr. Robert Welsh from Beaumont Health, and then we'll be followed up by Dr. Ash Mansour from Spectrum Health. Dr. Welsh.
Thank you, Mark. As you said, I'm a physician at Beaumont, and I joined our board of directors earlier this year. I'm one of 6 physicians on the board. Together, we carefully considered the opportunity to create a new organization with Spectrum Health, an action we enthusiastically endorse. Both organizations look forward to stronger relationships with our physician partners. As we work to create our new organization with Spectrum Health, physicians' voices will help shape our future. As evidence, at least 3 seats on the new board will be held by physicians. Our new system will connect physicians to a statewide network of expert colleagues. We look forward to opportunities for healthcare providers to share best practices and work together to advance clinical care to the benefit of our communities. Beaumont Health and Spectrum Health also have complementary clinical strengths, with Beaumont's 19 nationally recognized ranked specialties and Spectrum's outstanding Children's Hospital and their nationally recognized cardiac surgery program. My physician colleagues and I on the board are looking forward to our future together. Dr. Mansour.
Thank you, Dr. Welsh. This is really an exciting opportunity to collaborate with another health system that is similar to us with regards to the mission and the vision. By way of introduction, I'm a vascular surgeon at Spectrum Health, and I also chair the Department of Surgery at Michigan State University. Here at Spectrum Health, we're familiar with collaboration with other entities and other health systems. We're about taking care of patients, we're about education, and we're about research. I think this opportunity for Spectrum Health and Beaumont to come together will help our constituents, basically our patients. It will also provide opportunities for our trainees, whether they're residents or fellows, to train at these high-level institutions and afford educational opportunities for the medical students, both at the Beaumont or the Michigan State University, but also at the Oakland University Medical School. So I think this is really an exciting opportunity, and I've had the opportunity to meet with Dr. Welsh, and I think I'm speaking for the physicians at Spectrum Health who will be excited about this great opportunity. So thank you, and back to you, Mark.
Well, thank you so much, Dr. Mansour. I think now we appreciate everyone's remarks this morning, and Carrie and I are going to go through and we will begin taking questions from both sides of the state and in the middle of the state as well, I think. So if we could start off with WWJ Radio, we'd love to hear your question.
And just a reminder, if you're called on, please unmute yourself. And if you want to go on camera, feel free to do that. Do we have anyone on from WWJ?
We did, but it looks like they may not have a question. So let's try Mark Cabot from the Oakland Press.
No questions. Thank you.
All righty.
Great.
Kristen Shamus from the Detroit Free Press.
Thanks so much for taking my question. Could you share with us the total market share that this new health system is expected to have in Michigan once it's formulated and combined?
You know, we are really focused on providing care and coverage for the state of Michigan. And so what we're trying to do is deliver greater value to the communities that we have. And that can be through hospitals, but also through outpatient facilities and digital services. And so we are focused on how we can get to exceptional clinical care and coverage that is affordable, that is equitable, and that is accessible.
Great. Let's go on to Jacqueline Francis from Wood TV 8. All right, maybe Jacqueline is not on. So we will go to Sarah Lakuda from WZZM 13.
Yes, I hate to steal questions that were asked in the chat, but somebody had already asked this. I know you said this deal is a letter of intent, it's just happened. So is there a time frame as to when the deal will be finalized?
Thank you. Good question. So like we said, we've just entered into a letter of intent. Now we'll proceed through due diligence and the integration planning, and we'll also go through the regulatory review process. And we are hopeful that get through that process by the fall so that we can close by the fall.
Thank you.
All right. Anyone from Fox 2 Detroit like to ask a question? All right. Kimberly Craig at Channel 7.
Hi, folks. Yeah, quick question. So what about the nurses union? I see we have a couple physicians here, but how is this going to affect contracts that are currently in place with your employees?
This is John Fox. I'll respond to that. We obviously are going to honor all of our existing organized labor contracts. At Beaumont Health, we have about 2,100 people covered by union contracts, none of them in nursing. And we have spent a lot of time with our nursing leadership, frankly, over the last 48 hours discussing this, giving them a lot of information. They're very encouraged. Our nurses know the nurses at Spectrum well, their commitment to quality, commitment to the Magnet journey. And so it's all very positive to date from our nurses. They're looking forward to working with their colleagues at Spectrum.
Thank you, John. Let's go to John Cummings from Health Leaders Media.
Hi, thanks for taking my question. Actually, I got a this is Beaumont's third attempt in 9 or 10 years to merge with somebody. Henry Ford out of Aurora. What's different this time?
John, having a little trouble hearing your question. I think it was, what's the timeline?
All right. Okay, let me see if I can try that again. No, can you hear me now?
A little better. A little
better. How's that?
Better.
Better. Okay. Yeah, I noted that this is the third time in a decade Beaumont has attempted merger. What's different this time? What's different?
I think I have it here. So I'll go ahead and take that. I think the question is, what's different this time? Beaumont's tried to merge in the past, and why this partnership? It's really about the synergies of our organizations coming together. This is for Michigan and by Michigan. We have equal governance and a shared opportunity to work together on with our complementary strengths. Frankly, the Beaumont Health physicians know the Spectrum Health physicians. They've worked together, they've trained together. So it's really an opportunity now to bring those organizations and that value together.
And I would add that this is, we've come together and talked about why. spent a lot of time discussing why this is, why we want to do this. And as Julie said, this is for Michigan by Michigan. We truly want to transform healthcare in Michigan and to ensure that it is exceptional, it is accessible, it is equitable, and it is affordable. And by agreeing on that, that sets the stage for future success. And as Julie said, Spectrum Health physicians and team members have worked with Beaumont Health physicians and team members. And so we know each other, we complement each other well, and we're really looking forward to a bright future.
Thank you, Tina. Let's go to Grant from Channel 4.
Hey, I don't have any questions. Thank you.
All righty. How about Kate Wells from Michigan Radio?
Yeah, hi. Can you guys hear me okay? I'm having technical difficulties too. Okay, great. I'm hoping that we can talk a little bit about what the kind of role the leadership will play in this transition going forward in terms of continuing to talk with Beaumont physicians, nurses, et cetera, and assuring them that this is a system that they can be confident in. And then my sort of second question is, we've seen evidence in the past, and Representative Andy Levin just sent out a comment mentioning this, that mergers can lead to worse care for patients. I know you guys can't get into a lot of the details, but can you speak to that concern?
Well, this is Julie. I'll address the first portion of the question, and Tina, I think I'll let you address the second. You know, from a standpoint of the communication with Beaumont Health, as Dr. Welsh indicated, we have been working with the doctors all along, with 6 doctors on our board. We value their input. They have been critical as part of the development of this plan to move forward with Spectrum Health. So we believe that we have started that communication. We're continuing that communication, and we'll do so throughout the entire process as we develop the integration plan and as we move toward close of the overall partnership. Tina?
Thank you. So I really believe in engaging with people and having conversations. The people that are providing the care know what's going on well. And so to embrace a culture that's based on values, inclusion, transparency, and innovation, we really need to hear from others of what's going on. So I'll be doing a lot of listening, meeting with people, learning with people at Beaumont Health, as well as continuing to do that at Spectrum Health. My goal is that we foster a culture of the combined organization that builds upon our vision and our mission and our values as we go forward. And you asked a question about this combination to create a new system. Our focus is on driving greater value. There are many examples that we could share about the value that we are providing. And by coming together as an integrated health system with the health plan, Priority Health, we can do some unique things. There's an example that I could share with you in one of our advanced medical practices, where we've really focused on patients that are high risk. And what we've done in less than a year is we have reduced ER visits by 56%, which is just phenomenal. And the patient engagement is 97, a score of 97. And so we're reducing cost, we're improving quality and experience, and overall that impacts the total cost of care. And we can take that example, and I'm sure there's many other examples throughout this new system that we can then continue to expand and grow to deliver that greater value.
Thank you, Julie and Tina. Let's go to WWMT, Missy Broderick, if you're on the line. Maybe no question there. How about Roxy Elliott from ABC 57?
Hi, yeah, so we, in our viewing area, Spectrum Health Lakeland would be our hospital for our viewers. So kind of 2 questions here. Assuming all goes as planned, what, if any, really changes, I guess, would the patients be feeling in their hospital experience? And then also something that Lakeland has done a really good effort at is community outreach. We have even today the veggie van coming through Benton Harbor. They just wrapped up a series called Hidden History about equity and healthcare. Are those things still going to be prioritize those community efforts, I guess, as the system kind of grows.
Absolutely. I love the veggie van. It's fantastic to get into communities because we all know how much we need to have healthy food to make sure that we can live healthy lives. So that the community conversations that we have about diversity, equity, and inclusion, about health equity, those will continue. Lakeland is a very strong part of this new system, and they are one of the divisions. And for patients, nothing will change right now. For our donors, the philanthropy that is raised in the Lakeland area remains local, and the medical staff, again, remains local. We are really proud of Lakeland and all that they have brought to our system, and we are so excited about creating this new system with Beaumont Health and Spectrum Health coming together, because we can improve in the quality of care that we've seen as Spectrum Health and Lakeland, when they came together, has done so far.
If I could add to that, Tina, the individual boards, so Beaumont Health Board, will maintain local fiduciary responsibility. And so I think some of that local aspect that you're talking about remains within the organization. And that's a very important aspect. And to answer an earlier question, also something different than the previous deals that Beaumont had talked about. So it's really important that we recognize that, you know, medicine is best practiced locally, and we need to do that. So I wanted to add that to Tina's point.
Thank you, both Julie and Tina. Let's head over to Dustin Walsh from Cranes.
Hi, thank you. The thing I'm struggling with is we keep talking about cost savings. We have two disparate systems without any overlapping geography. Obviously, there's going to be cost savings maybe among the actual operations of the company by eliminating, you know, duplicative efforts. How does the cost savings come in for the actual patients? Is where I'm struggling to connect the dots. Well, I mean, explain it to me like I'm 5, because I'm confused as to why, how that necessarily translates to cost savings for the patient.
I'll take a stab at this at the start. The one simple area is technology. It is so expensive in terms of healthcare to keep driving and advancing your technology, particularly around your information IT. That if we have a chance to spread that over a much larger system, the unit costs of providing that technology drop very quickly in a very concrete way. And you're usually providing better technology for our patient care teams, for the patients, their families, more accessible. That's an area where both Spectrum and Beaumont are very focused. We've talked about a lot, and where we think we can deliver new value. I think I'll maybe ask Tina to comment with respect to the total cost of care and their experience with Priority Health, which is really deals with what the consumer and the employer ultimately pay for their total care over a year. Tina?
Thank you. So I'll go back to the comment that my story about value-based care and our clinic. What we're really trying to do is help people be healthy. If they can be healthier, avoid the emergency room, get all the things they need so that they don't need to go into the hospital, we're going to save money for the healthcare system. And when you do that, then the total cost of care is reduced. And so that's what we look at. It's something that may need to take a year or two to get done, but that's the focus, is how do we get people healthier so they use less healthcare services, especially less healthcare services that are high cost. And so that's our effort. I'll go back to the story. We really have partnered with patients who were frequent users of healthcare, and we've partnered with them with not only the physician and the advanced practice professional, but also a dietitian, a coach, a social worker, a pharmacist, to help them better manage their chronic diseases. And as you do that, then the utilization of healthcare changes over their lifetime so that it costs less to take care of them and they are actually healthier.
So not to belabor the point, but just want to make sure I understand. So what you're saying is that effectively Spectrum is a better operator than Beaumont and therefore can bring their operations and lower the costs at Beaumont for Beaumont patients.
I think coming together, we complement each other in our strengths, and we are going to be able to learn from each other and how we do this. There are benefits on both organizations of how well we've taken care of patients, and I'm looking forward to learning on those opportunities. Combined together, we can have those synergies to really impact the value of care.
All right, thank you, John, and thank you, Tina, for those responses. Let's go to Mark Sanchez from MI Biz.
Hi, good morning, everybody, and thank you for your time. A few questions. First, going back to the 1997 merger that created Spectrum Health, there was a consent decree, and Spectrum agreed at that time to some financial transparency initiatives, community commitments. I'm curious, in Spectrum today continues those commitments even after they expired some time ago. Will Spectrum, will the new health system maintain those types of commitments going forward once this deal closes?
Mark, I think your question was about the transparency, and it is, we will be continuing our transparency efforts. You can see that information on our website right now, and we really want to make sure that our patients and our members understand what the cost of care is. And so we've been proactive about putting that information on our website, on the Priority Health website, and that will continue to be a priority to ensure that we are transparent.
A second question, how may this affect philanthropy? Do you envision a single statewide foundation, or do you maintain the existing foundations in each of your markets?
Well, philanthropic dollars will remain local. And so I do see that the philanthropy and the foundations will be in their particular regions, but I'm sure there will be collaboration across those regions to ensure that we're connecting with each other and learning best practices. But we are very, very proud of and thankful and grateful for the philanthropy that has been given to all of our organizations. We would not be the organizations that we are today without the philanthropy and the donors and the supporters that we have. And we want to make sure we continue to use those funds as directed by our donors.
And finally, as you go about your work in the next number of months, putting this together with your integration plan, your due diligence, there is, without a doubt, for people who have been in Michigan for a while, kind of a social cultural difference, somewhat of a divide between Southeast Michigan and Grand Rapids and West Michigan. Is that an issue, or how do you make sure you bridge those types of different cultures between Grand Rapids and Detroit? Is that a barrier or an opportunity to bridge those?
I slightly heard your question, Mark, but I think what you're talking about is how will we connect West Michigan and Southeast Michigan together in our various cultures. And what we need to recognize is that our cultures make us who we are, but we also want to have similar values and mission and vision, and we'll continue to go there. I think the key point here is that we need to connect. We need to listen to each other, we need to collaborate, and we are all focused on how do we transform health in Michigan. We want the same thing. We want to deliver greater value for exceptional clinical care and coverage that is equitable, accessible, and affordable. And because we're aligned on that, that should be our focus.
Thank you, Tina.
I think we can go to Brian McVicker. I think you have a question in the chat from MLive.
Tina, during your introductory remarks, you spoke a little bit about not anticipating any job losses or building closures. Can you talk a little bit about why you anticipate that there will not be any job losses or building closures? It seems from an outsider's perspective that there would be some element of duplicative services that would be eliminated.
Right now we are really focused on bringing the two organizations together. Both organizations are strong. We have complementary strengths, and I see a lot of opportunity for us to come together and find new opportunities. We want to continue to grow. We want to innovate. We want to be the place that people want to be part of, an inclusive, diverse culture that's really driving and transforming health in Michigan. So I'm hopeful we'll be a place that people will want to join with us to do this transformation.
One more question, please. Just on due diligence and integration planning, can you talk a little bit more about what sort of work you folks have to do in the course of that?
Yeah, so in due diligence and integration planning, we share information to understand each organization in a little bit more detail than we have so far. And so that will begin now. And then we'll also start planning for the integration. So what happens post-close, post we get to that integration agreement. And then during this time, we do submit for applicable regulatory reviews, although we don't expect any concerns right now. If there are any that are raised, we will address those.
Okay, we're also getting texted some questions because I think some reporters are having trouble talking if they're on the phone. One is a pretty simple question. What will the new name of the system be? And then if you can talk about kind of what the branding might look like after that. And then again, just elaborating a little bit on what you expect the next remainder of the year to look like as we go through this process. What's the time frame look like? If you can kind of reiterate that a bit.
So we both have very strong brands in our respective markets, and we want to honor those and recognize that, but we are coming together as a new system. And so as a new system, we want to have a new name. The temporary name will be BHSH system. The current names will remain in their markets right now, and we will be putting together a plan for how to determine what that new name, that permanent new name will be after we get to close, after we get through the integration agreement. The second question, Mark?
Just what you expect the next few months, the remainder of the year to look like as we move through this process. How will that go?
I think there will be a lot of listening, a lot of connecting, a lot of collaborating. There'll be a lot of work to do the due diligence and the integration planning over the next few months. But I'm hopeful that as we come together, we'll find even greater opportunities to innovate and grow and deliver greater value for our communities.
All right, excellent. Let's go back to Kimberly Craig at Channel 7.
Hey folks, yeah, so we know that the pandemic proved to be painful for hospital systems, particularly here in Beaumont. And so as a result of the pandemic, what's the benefit that you see going forward? I think somebody mentioned something about the pandemic earlier, but what's the benefit that this merger might be then for the two systems merging if, God forbid, there's another pandemic?
I'd like to respond to that, Kimberly, because it's a great question. I'll say this, at the first week of the pandemic, I think Tina and I were talking at least 3 times a week, and frankly, often daily as the intensity of the pandemic hit, particularly here in Southeast Michigan. And then our care teams were talking to each other, our infectious disease physicians, our laboratories. And before we got into any partnership discussions, we were learning a lot about each other in trying to deal with this extraordinary event of an international pandemic. And frankly, within no time at all, that was very porous in terms of exchange of information, helping each other. What kind of test platforms did Spectrum have? We told them what we had. We were willing to share potentially supplies with each other. In short, we had each other's back very quickly. I will tell you the pandemic was an extraordinary bonding experience for the two organizations that I don't think has any counterpart in any sort of potential combination I've ever seen before. And I think that experience really will enable us to go forward. So God forbid we have another pathogen like this rear its head and really challenge our communities. Since it doesn't always happen in a uniform way in any region, we can help back each other up and respond more effectively. But we've got, I think, much more sophisticated technology now in terms of clinical laboratory medicine and the other tests to deal with these kinds of issues. But the real output of this was our teams know each other a heck of a lot better. And it was a very positive experience, I think, for Beaumont and Spectrum.
I would agree with that. Our teams really did come together and collaborating, learning from each other, and making sure that we could provide even better clinical quality care. And I expect that we'll continue to do the same. What this allows us to do is really work together, not even in a pandemic. And I hope there isn't another one, because we want to make sure that we are continuing to improve on our quality, on our safety, on the equity of care, and we'll be pushing on that. I also would say that the bond between our teams has been very helpful as we've gone through this. And I just want to recognize the amazing care and compassion and courage that every healthcare worker displayed throughout this time. They are incredible, and I am so grateful for all of them at Spectrum Health, Beaumont Health, and throughout our state and country.
And if I could just ask a question about Priority Health, I mean, how can you assure those customers that, you know, they're not going to see an increase in their costs for insurance coverage?
Well, our focus is on affordability, and that's what we've been driving towards. And so if you look at the trajectory there, we really want to make sure that we are affordable, and we focus on how do we make sure we in our products, we have the best products and benefit plans that provide the coverage for individuals, whether it's in Medicare, Medicaid, individual product, or employer-based. And so that's our focus. We know that health insurance is expensive, and we want to make sure that it's affordable.
So there's nothing on the table that would indicate or that should point to a rise in cost.
Right now, we've already submitted our rates right now for things, and so our focus is on how do we actually reduce the total cost of care.
Thank you both.
Let's go to Kristen Shamus. You have a question in the chat.
Thanks very much. Wondered if you could talk at all about what will happen to university or medical school partnerships in this deal.
Well, we're really looking forward to the partnerships. You know, we have Michigan State University, Oakland University School of William Beaumont School of Medicine, and Wayne State University. We love that we have partnerships with all of these fine organizations. We believe it's an opportunity to continue to grow in our academics, our residencies and fellowships, as well as our research portfolio. We have aligned interests in those areas, from clinical to health equity research and many other areas. And so I think that it will continue to grow in those. There may be some of the physicians that would like to comment on the opportunity that we have with the universities.
I can take that, Tina. I think as you heard earlier, there are opportunities for us to improve research and education. Our medical students at Michigan State University are always looking for opportunities to collaborate with researchers and epidemiologists about projects that can enlighten them in their education. And I think having a broader base for the students to be able to rotate at and other researchers and scientists that they can collaborate with will be a fantastic opportunity for them. And I think I could say the same for the students at Oakland University. They'll have opportunities to collaborate with our researchers here, and we can offer our expertise to them.
I'll just echo what Dr. Mansour has said. I think that the medical students at Oakland University, this will expand their opportunities for their clinical opportunities, particularly in the later years of their education. There may be opportunities that aren't available in the Beaumont Health System that they could avail themselves with at Spectrum. And similar, there may be opportunities that the Michigan State students will look forward to engaging in that Beaumont could provide them.
All right, thank you both. Sounds like Mark Cavett at the Oakland Press. You have a question?
Yeah, my question's for John. I'm not looking for too many specifics here, but what led to your decision to leave the organization following the merger? Describe what your role will be during the transition process.
I view my role as to help the organization. Tina and I have known each other for over 6 years. We've both been on the MHA board and have worked very, very well together. Mark is pretty straightforward. I turned 70 this January, and as much as I'd like to stay in healthcare for another 20 or 30 years, my wife and my grandchildren have told me that I probably should open up a new chapter. I actually found out that we're having a 5th grandchild last night, so it's even more demand than I expected.
So you never considered, John, serving on the new organization's board of directors or serving in any kind of capacity there?
No, not really, Mark. I think it's important. I really believe that the organization needs a single CEO, and I'm happy to help in any way I can. And maybe, Tina, Julie, Bob, and I can talk about that going forward. But I really do believe that the organization needs a board totally committed to the new organization, and also a management team built around that organization to really carry it forward. So again, that was part of my thinking, and that's where we are at this point.
Thank you.
I'd like to go to Alexandra Newen from the Herald Palladium, if you've got a question. Okay, that's fine. Maybe we'll go to WSJM. Are you on the line and have a question? Okay, what about Grand Rapids Business Journal? Are you on the call and do you have a question? All right. Mark, anyone else on your list?
Yeah, I was just looking through the chat, and it looks like there's a number of people asking questions about what sort of regulatory approvals might or might not be needed. So if anyone could kind of weigh in on that aspect.
We believe that this combined organization will really benefit patients, members, in the state of Michigan. And we have confidence that the regulators respect the fact that our organizations are nonprofit and mission driven. In addition, Beaumont Health and Spectrum Health operate in distinct markets with no market overlap. So as a result, I do not anticipate any regulatory concerns.
Beaumont views it the same way. And again, we are going to go through that process over the next few months.
Wonderful. Well, if we don't have any more questions, Mark, any on your end, and maybe we can turn it over for some closing remarks. But I'll turn to you first.
Yeah, it looks to me like there are not any. Do any reporters have any final questions? This is your time.
Yeah, just real quick. This is Sarah Swick with Michigan Radio. I didn't hear anyone specifically answer the questions about the anticipated dollar value and the market share questions here, and I was just wondering if somebody could get those.
Again, our focus is on how we deliver greater value to our community. So you can provide care in a number of different settings, but we want to make sure that we are transforming health. We're innovating. We're trying to build something that is new. And so our focus is on value, on accessibility, affordability, equity, and exceptional clinical care and coverage.
It looks like there's just, again, a couple other reporters asking for, and I know you've talked about it several times, Tina, but further questions about any sort of review that might be needed. What are our thoughts on there? So maybe if you could just emphasize again where we're coming from that perspective. It seems the reporters still have questions.
There are many areas where we need to submit information for regulatory review, and so we are doing that, but we do not expect any regulatory concerns.
Mark, this is John Cummings. Can I have a quick question? I know you've talked about reducing cost of care, et cetera, but nonetheless, with larger footprint, do you anticipate that this will help leverage higher reimbursement for health?
I couldn't hear your question.
Oh, I'm sorry. You had talked a great deal about keeping healthcare affordable, but nonetheless, do you know a big reason why health systems consolidate is get more leverage with payers? Do you anticipate that this larger footprint will allow this new health system to negotiate higher reimbursements from health insurance providers?
And it is our focus and our commitment. We are trying to be affordable. Our focus is affordability, greater value for our communities that we are serving. We want to transform healthcare. We want to reduce the total cost of care. That is what we are trying to do with this.
But again, do you anticipate that you'll be able to go into a negotiation with, say, Blue Cross Blue Shield and say, we got a big footprint, we want more money?
Our focus is on delivering greater value to our community.
John, I would add to what Tina said. It's the, frankly, we believe Beaumont, in terms of a unit cost, is extremely competitive in Southeast Michigan. Most people have prices that are higher than ours. The problem for the consumer, the problem for the employer is the total cost of care. It's the utilization of things. And it goes back to what Tina alluded to. It's really keeping people healthier, keeping their chronic disease under control. If we can reduce the utilization or the acuity of chronic disease 5% for congestive heart failure, hypertension, those conditions, we will create tremendous value for our community and reduce the total cost of care. And that's really what the employer and the consumer feels. It's the total cost of care. It's not really the price for this or that. And that's our real opportunity. And I think where the partnership with Priority Health represents an extraordinary opportunity for Beaumont.
And we want to make sure we're working with partners to drive value.
Well, along those lines, will you have to offer, say, Blue Cross Blue Shield, the same rates as you offer Priority, or can you give Priority allow them to reimburse at a lower rate? How does that work?
And we work with all of our partners to make sure that we're delivering greater value to our communities.
All right, well, thank you everyone for joining us today. We've had a lot of great questions asked today. I want to remind you all, if you aren't aware, we did launch a website today as well. It's formichiganbymichigan.org, and there's lots of great additional information on there, including FAQs, the news release, and a letter to our community. So we do encourage you to visit that. And now I'll turn it back over to Tina for some final closing remarks.
Thank you very much. So thank you so much for joining us today and asking these questions. We are very excited to transform health for Michigan. After this past year, we are more emboldened than ever to do better at helping the people of Michigan be healthier. This bold opportunity accelerates our ability to provide even greater value to our communities through exceptional care and coverage that is accessible, equitable, and affordable, while maintaining our unwavering commitment to our local communities in Michigan. I also want to recognize and thank, like I said before, our Spectrum Health team members, our Beaumont Health team members, and all healthcare workers. Their compassion and courage throughout this past year is incredible, and I am so grateful. From the team at Spectrum Health to the team at Beaumont Health, we are very excited to partner with you. We will dare to be different, we will dare to be bold, and we will transform health for Michigan by Michigan. And to all Michiganders, we are coming together for you to improve the health of all of our communities. Thank you for joining us today.
Thank you all very much.
Thank you, Tina, and thanks everybody for joining this afternoon. If you have additional questions, please reach out to the Beaumont or Spectrum Health Media Relations teams, and I hope you have a great afternoon. Bye-bye, everyone.
Thank you.
Thank you.